Premier Andrews says masks will be mandatory for as long as they're effective in preventing community transmission, so people can expect to be wearing them for the foreseeable future. Of course, face masks are now mandatory in the Shire of Mitchell and Greater Metropolitan Melbourne for all those aged over 12 years old. If you don't wear a mask, police can issue a $200 on-the-spot fine. We also know that major retailers and major supermarkets, including Coles and Woolworths, will be refusing service to people not wearing masks and will call police if customers refuse to comply. Health authorities, though, have urged people not to be too judgmental if they see people not wearing masks out on the streets. There are valid medical reasons not to wear a mask. Now, some at home may be asking the valid question of why I'm not wearing a mask right now. There is an exception in place for live broadcasting, but rest assured, Pete, as soon as we finish talking, the mask goes straight back on, and Sky News crews across Melbourne will be wearing a mask whenever they're not on camera. Now, Victoria recorded a record 484 new cases yesterday. Some very alarming statistics as well. 9 out of 10 people who ended up testing positive to coronavirus did not self-isolate upon becoming sick, instead going out shopping and going to work, driving community transmission. 5 out of 10 people as well continued to go out even after being tested while awaiting that positive test result. That is all driving the very alarming community transmission figures. 205 people are in Victorian hospitals with coronavirus, 40 of those in ICU, and further proof that this is not just an old person's disease. About a quarter of those are under the age of 50, including one child under the age of 10 and 2 people in their teens. We know, though, it is particularly dangerous for the elderly, and about a quarter of all 44 deaths in Victoria are from aged care homes.